Summary of action taken and planned activity under each of the 3 settings. Welfare system. Supporting people into work, employment and financial support. In the welfare setting, we want a system which offers disabled people and people with health conditions personalised and tailored support adapted to their needs, and which links them to healthcare and other services for support. In response to what we heard in the consultation, we have focused on our key areas of activity. We will continue with more training to help work coaches work better with people they are helping. We are making sure employment support is designed to take account of personal circumstances. We will continue to change the assessment process so that people can access the help they need. And we will help those in the support group build their confidence and employability. We have already made a start. For example, new training for work coaches, introducing health and work conservations, testing what sort of employment support works best for claimants, and ending reassessments for people with the most severe conditions. In the workplace, supporting employers to create healthy, inclusive workplaces. In the workplace setting, we want employers to have the support and confidence to employ disabled people and people with long-term health conditions, help them to stay in work, and to create healthy workplaces where people can fulfill their potential. Employers play a big role in helping people to stay in work and move into work. Since we published the Green Paper last year, 2 independent reviews have been released. Matthew Taylor's review of modern working practices, Lord Stevenson and Paul Farmer's review of mental health and employers. Both of these have made suggestions for how to make the workplace better for people. We want to show businesses the good things about employing lots of different people, and the positives of helping disabled people go as far as their talents can take them. We want to support employers to do this by making it easier for them and providing them with the advice they need. The work we are doing in the workplace is improving advice and support for employers of all sizes, making the civil service a leading employer, improving transparency, changing the way statutory sick pay works, making sure the right incentives and expectations are in place for employers. In health settings, supporting employment through health and high-quality care for all. In the health setting, we want occupational health services which offer individuals help when they need it. And we want doctors and people who work in healthcare to talk about work with their patients. Improving healthcare for people while at work is important to our plans, as this will help people avoid illness and help them get better when they are unwell. What you said to us after the Green Paper has led us to focus on the need for prevention to help keep people healthy, encouraging work and health services to join up, improving services and testing new ways of providing mental health and musculoskeletal services, making the fit note work better, making occupational health better. We have already started testing new ways of joining up employment and health services. This includes putting more employment advisors into mental health talking therapy services, we are also working across government, with local people, employers, disabled people and people with health conditions to create the best change we can. UK and devolved administrations. Our vision and goal to see 1 million more disabled people in work covers the whole of the United Kingdom. There are some areas of policy that are for Scotland, Wales and Northern Ireland to make decisions on. The UK government will share learning with them for the benefit of all UK citizens. Conclusion. This publication is the start of a 10-year programme of reform. We will learn from testing new and different things and work with people who use the services, as well as with other organisations. Chapter 1. Employment and financial support in the welfare system. The welfare system is an important part of society. It supports people when they need it and helps people start work and stay in work. We want to make the system even better by making it work for everyone, making sure that support is tailored to the people who are using it. Our work goes further than providing a safety net. It is about offering better support and greater choice. Supporting work coaches to better help claimants. What we heard in the consultation. When we asked people what they thought, they said that they would like more work coaches and for them to understand disability and illness better. You also said you wanted work coaches to have mental health training. People said that they wanted their own work coach who had more time to spend with them so that they can get to know each other. People also said that they wanted everyone to know what support is out there and stop benefits being seen as a bad thing, so that people are happier to interact with the system to get the best out of it. What we are doing. New work coaches have 3 weeks of training, which includes health conditions and disabilities. We are also looking at how to improve the support we offer to work coaches so that they are able to help people claiming benefits as much as possible. The Health and Work Conversation has been rolled out to claimants on employment and support allowance and is now also an early part of the universal credit process. The Health and Work Conversation is a conversation you can have with your work coach about your goals for the future. It helps the work coach better understand what is important to you and to build a relationship. It is not about finding work straight away, but putting you in the best position for when you do look for work. Personalised employment support. While we want support which is personalised, we also want it to be flexible and move with people when they move across the system. What we heard in the consultation. People also wanted support to be voluntary, meaning people choose whether or not to receive it. Some people also agreed that it would be a good idea to put some mental health professionals in employment services. Some people also said that the government should look into self-employment to see how this could become a better option for disabled people and people with health conditions who want to work. What we are doing. We have started to roll out several new ideas to offer personal support, such as the Personal Support Package. We also want to make local support better, letting local organisations deal with the local settings they know best. This is why we have started the Work and Health programme, which provides specialised back-to-work support for people with disabilities and long-term unemployed people. Some of our work will be focusing on mental health and musculoskeletal conditions. This is because we know that these conditions have a big impact on the lives of many people in the United Kingdom. We are also looking at the best policies to support people who have the greatest needs and are in the most complex situations. We are also working across government to support people with learning disabilities or autism. This is because we know that employment for people with these conditions is low, and we are committed to making their lives better. We will also be working to make the move from education to employment better, as we know this can be a hard time for disabled people and people with health conditions. Many people have told us that one reason people with learning disabilities and health conditions often have a poor employment experience is because from a young age, self-belief and ambition about working is often low. We want to change this through accessible apprenticeships, a new system of on-the-job training. These apprenticeships recognise the different needs of disabled people and people with health conditions and make changes for them in the maths and English requirements. The government is committed to helping everyone achieve the best they can in life, and this includes social mobility. The government wants everybody's hard work to be recognised and wants everyone to have the chance to do different jobs to their parents. If somebody is talented and willing to work hard, then their opportunities should be endless. The government is creating a new careers strategy for schools and colleges which focuses on social mobility. We also want to make sure that every young person who has an education, health and care plan has the chance to take part in a supported trial period at work to help them build their work skills and experience. We are also testing peer support models for disabled people and people with health conditions who are unemployed, to see if this builds their own self-belief and expectations about work.